for your questions.
And I'll thank you for the certificate you gave me, and I used it all.
You'll get it again.
Before I ask my questions, I'd like to make a brief statement about PBMs. Along with Chairman Wyden, way back in 2018, I've called for transparency and accountability of PBMs. We know PBMs are getting away with shady, anti-competitive practices that are costing patients more and taking a toll on rural drugstores. The partisan reconciliation law did nothing to address the powerful prescription drug middlemen driving up drug caucuses in this Congress. 4 Senate committees have, including this committee, have advanced bipartisan PBM bills. All 4 of these have garnered the support or co-sponsorship of 68 senators. So there's no reason these bills should not be advanced. In July, the Federal Trade Commission released an interim report confirming my concerns about concentration and possible anti-competitive behavior of this industry. I've introduced the prescription pricing for the People's Act, requiring FTC to conduct this PBM study and report back to Congress within a year. The Senate shouldn't waste any more time in taking up this very important issue. So, Mr. Merkel, I've got questions for you. In July, the administration announced cost-shifting plan to hide the negative impact of partisan reconciliation bill prescription drug prices. This demonstration program seeks to artificially lower Medicare Part D premium payments using taxpayer dollars and establishes risk corridors for insurance companies. The administration's attempting to patch things up ahead of the November election. I've asked the nonpartisan CBO to analyze the fiscal impact of this policy. Why is this administration establishing this cost-shifting policy, and how much money will this cost the taxpayers?
Happy birthday, Senator. Thank you for the question. So the IRA took a previously bipartisan idea. There was a lot of support for the out-of-pocket cap in Medicare Part D, but it moved away from the bipartisan discussions to shift the proposal in a way that would cost more for taxpayers and potentially cost more to beneficiaries and higher premiums. So in the underlying IRA, there was a program to artificially keep premiums low for about 6 years, was going to cost around $40 billion, but even that was not enough. So what the administration has done is they saw there was a premium spike last year. They were very concerned about a premium spike this year, so they have created, as has been mentioned, a 402 demonstration project that basically just pays Part D plans. CMS is saying around $5 billion in just 1 year to keep their premiums lower.
Okay. Mr. Merkel, as you're aware, the Paragon Health Institute recently issued a study finding that 5 million individuals have been falsely reporting their incomes to qualify for these subsidies. This overestimate of income comes with a price tag of $20 billion just this year. July 1, I sent a letter to HHS asking controls the agency has in coordination with the IRS to stop this abuse of taxpayer dollars and what they're doing about it. I've yet to receive a response. This is my question. HHS says it's working to combat unauthorized and fraudulent activity in Obamacare. Should we believe that they're accomplishing that?
Well, I believe that they have some concerns about fraud. There are obviously good people over there. However, there is no sense that I can tell that they appreciate or are willing to be forthcoming about the potential magnitude of this. They have announced that they are going after roughly 200 brokers. There absolutely is some activity where unscrupulous brokers are switching because of very, very lax program integrity controls, people into plans without their knowledge. However, this is just the tip of the iceberg. I appreciate your interest in pushing them for more answers on this because, frankly, I think that they likely announced that minor action and hope it blows over.
Mr. Chairman, I'll submit questions for answer in writing.
Very well, and a good birthday to you, Senator Grassley.
Thank you very much.
Okay, Senator Langford.